my main goal of talking tonight is to hopefully enhance a little of your knowledge based on the tick-borne illnesses. So if you please have any, I guess my main objective is to answer any questions that you might have, okay? So the way I got started in the tick-borne illnesses, I'm in Bedford, I'm family practice. We do a whole gamut of things. I do chelation therapy. I have different vitamin and mineral IV drips that we do based on the person's health or illness at the time. And we also I do some anti-aging medicine with bioidentical hormone replacement therapy. And one of the thoughts with that is not to make people live to 130 years old, but to have them be healthier for the time period that we're here, to have a better quality of life during that time. So I certainly do think that makes people live longer also. So several years ago, a couple things happened. The first thing, I lost my father, which he was 95 years old, so you can't complain about that too much. But my dad had no heart disease, no diabetes, no cancer, but mentally he just left. So he was labeled with dementia, and I'm thinking, why? My grandfather died at 99, and 3 months before he died, he could have been sitting in this room asking questions with us tonight. So I started thinking about things. And then another thing happened is my first career was in horses, and I had a horse that was in his early 30s at that time. And the guy taking care of him called me one day and said, Ruth, hey, I don't know what's wrong with him, but he's just not himself. So, the vet's coming out, can you look at him? Well, certainly. So we pulled blood work on him, and lo and behold, he had Lyme disease. Treated him with doxycycline for 3 or 4 months. He was back acting like a 20-year-old again. Okay, so what's the best model? As an animal model, you take out all the placebo effect. You take, he doesn't know what we're putting in his feed every day. And he lived to be 35. And then I lost him about 2 years ago. And then I started realizing that so many people were coming in and sitting in that chair with me saying, hey, I've got Lyme disease and I'm not getting better and I don't know what to do. So I always knew there was 2 theories on Lyme disease. And I said to myself, well, I guess you better go learn a little bit more about Lyme disease because no one's helping these people. So I don't consider myself a Lyme expert by any means. I'm not a Joe Jemsek, I'm not a Richard Horowitz, but I do think I know a little bit more about Lyme than the average person practicing in this area. And as I'm sure you've read, we have, Pennsylvania is the highest state of tick-borne illnesses and the diagnosis of Lyme disease. There's supposed to be something like 300,000 new cases every year of Lyme disease. I think it's way beyond that. Risk factors, well, number 1 is you just live in Pennsylvania. Number 2, who lives in this area and doesn't do some kind of outdoor activity, right? We're all out, and these ticks are in your yard as well as in the middle of the fields, in the middle of the mountains, in the middle of the woods. Okay, how many people live with an animal? Okay, that's about everybody in this room. Well, I had a black German Shepherd that was about 120 pounds. How many ticks do you think I would ever find in a solid black long-haired coat? You don't know. Also, the deer ticks, which are supposed to be the predominant carrier, are so small, you'd never find them anyway. So, horses are another big risk factor for Lyme disease, okay, and much more prevalent. So I started going to ILADS conferences. So now all of a sudden people know this. I'm on the ILADS website, and we get tons of people coming in the door for Lyme. I start them, I get them on, and I'm going to go over kind of my approach to it tonight. If I can't get them better, believe me, I'm sending you out to somebody else. There's a couple docs fairly local, one in Shippensburg, one in Harrisburg area, one out by the Ohio line, I think are the 3 next closest. I work with all 3 of them, and I can do the local work and then have them help me with the deeper work, okay, and direction. So anyway, a lot of my people come in and the first thing they say is, well, I got bit by this tick, I don't feel good, and my doc ran a test on me called an ELISA, and it's negative, so I don't have Lyme disease. Okay? Does anybody know about the testing for Lyme? Okay. Okay, so a couple people do, most people are shaking their heads no. Okay, so there's really two kinds of testing we can do, direct and indirect. Okay, so in an indirect test, we look at your immune system's response. Okay, so you've heard of antibodies? Okay, that's what your immune system makes if you've seen something. Okay, if you've seen, that's a basis of immunizations, okay, and vaccinations. We give you a little piece of the bacteria, show it to your immune system creates antibodies, then if you actually get that disease, the antibodies are there to jump on top of it and attack it right away, so you don't get the disease, or you don't get as sick with it as what you would if you didn't have this immunity build up. Does that make sense? Okay, so that's the easy test to do. It's a cheaper test for the labs to run, but the problem is Lyme disease can transform itself. It can fool the immune system. So you don't get an accurate response. With an ELISA test, 35 to 50% of them are wrong. So you might as well just flip a coin. You've got an equal chance of finding it. But in traditional medicine, man, we want that test. We want to know yes or no. We want to go by what the lab says so we can make that, no, you don't have this. Okay. The next test to look for is a Western blot. Has anybody heard about that? Okay. So a Western blot is another.
Indirect or is that direct?
That's still an indirect test. It's still looking at how your immune system reacts to a certain part of the bacteria. Okay? Well, there's a couple problems with that. Again, it's an indirect test, and we've already said that Lyme kind of messes with the way your immune system responds. Plus, years ago, the CDC came out with these criteria. Okay? And there's two parts of your immune system that we look at. The first is an IgM. Okay, I have to break things down pretty simply so I can understand them because that's the way my brain thinks. Your IgM part are your Navy SEALs. Okay, you define a problem, you send in the SEAL team, which is hard, quick, fast response. Right? So that's the IgM part. They last about 4 to 6 weeks, and then the SEALs back off the fight, okay? Because at the same time the SEALs go out, your body starts making the IgG part, okay? That is your heavy artillery. That's the stuff that takes time to go in and creep up to the front line, but then it's the hard stuff that's there for the long, hard fight. Make sense? Okay. So, years ago, the CDC came out and said, okay, then back up. Then within these sections for Western blot, you have, for the IgM, you have 3 parts, and they all look at a little something different, like outer surface protein A, outer surface protein B, outer surface protein C. Some look for the flagella, okay? So the IgM has 3 parts, the IgG has 10 parts. Years ago, the CDC made some decisions, and they said that to be positive for Borrelia burgdorferi, which is the causative agent of Lyme disease, you need 2 of the 3 for the IgM, and you need 5 of the 10 for the IgG. Problem was, that was meant for their statistical analysis. That was never meant for diagnosing and treating a patient. But what do most practitioners go by? Oh, you're not CDC positive. Okay? So, the other thing is, the next part of this, in both of these tests, we're looking for Borrelia burgdorferi, okay? Which is the genus and species of the bacteria that is associated with Lyme disease. So you're looking for canine German Shepherd, okay? There are over 100 different species of Borrelia in the United States, and we believe there are over 300 different species worldwide. So we're looking for the canine German Shepherd. If you happen to have the canine Chihuahua, you're still sick from having the Chihuahua, but the German Shepherd is no. Does that make sense? So the Chihuahua can still be making you sick, but you don't have the German Shepherd. Okay? So, more fallacies with the tests. So what do? The other set that we said were direct tests. Okay? And these are just starting to evolve. The problem is they're more expensive to do. And unfortunately, a lot of the insurance carriers are stuck in the indirect testing. Okay. So, has anybody heard of a lab called IGeneX? Long-term, been around for as long as I remember. Okay, and they were the best ones to go to for. Got to back up a second, because I missed something. The most sensitive bands in the Western blot are bands 31 and 34. Okay? They were excluded from the common kits that labs get. So if you send to Quest, bands 31 and 34 are not even on the Western blot. Okay? So they don't look for the two most specific bands to tell you if you have Lyme disease or not. IGeneX includes bands 31 and 34 on their tests. So that takes them up another level. Okay? Plus, the other thing is, IGeneX do DNA testing called polymerase chain reactions, and also FISH testing, which is fluorescent in situ hybridization. So these are direct testing. They're looking for the critter itself. Okay?
What was the second one?
FISH.
FISH testing.
F-I-S-H. Yeah. Okay? And that's how it'll be abbreviated. You don't need the other part. Okay, so that's looking for the actual organism itself in the blood sample that we send to them. In addition to that, there's now a company near Philadelphia where they do cultures, which are the gold standard in infectious disease. So they will take a sample of your blood, put it in an auger or a culture medium, and throw it in an incubator. And it takes 16 weeks. Most cultures, if you go into the hospital with a urinary tract infection and they culture your urine, we'll have the results in what, 3 days? It takes 16 weeks for them to say that the culture is negative for Lyme disease. So it takes a long time, and it was very specific, and I can't tell you what they use for the culture medium or anything, but I know they had difficulty. Joseph Burrascano, who was very instrumental in working with them to get the culture medium. A newer lab that just came out is out of Colorado, and they're doing a urine collection. And then they're doing DNA testing on that urine so that we can actually see the organisms being excreted. That's the one it's really pretty new, I'd say within the last 6 months or so, and that's the one I'm starting to do more and more of, because for IGeneX, for me to look for Borrelia burgdorferi, Babesia, and Bartonella, it's about $800 to $900. For the urine test, I can look at 11 different things, and it costs about $500. So I think this is the biggest bang for the buck. So that's the one that I'm starting to do a lot more of. It will look for a couple different species of Lyme, the most common species of Lyme. It'll look for 2 Babesia, 2 Bartonella, Ehrlichia, and Anaplasma. I think I have that right. Okay, The Babesia, the Bartonella, Ehrlichia, Anaplasma, Rocky Mountain spotted fever, Q fever are all, quote, co-infections. Okay? So, supposedly what I've heard lecture to is that 50% of the ticks that are out there today are infected. If they are infected, it's not just one thing, it's 2 or 3 bacteria that they have. Okay? Supposedly 50% of the nymphs are born infected now, which is a change. It used to be that the nymph was born, its first life cycle, it attached to a white-footed mouse, which is the true vector of the disease, okay, and then fell off, and then its next life cycle was on the deer. Okay, now they're saying 50% of nymphs are born infected. Okay, so if I would do some lab testing on you, or on a patient that comes in, and if I found Babesia and Bartonella, I'm almost assuming you have Lyme also, without being able to prove it by the lab test. And you also treat the patient. If the person especially knows of a tick bite, they got a rash, they got Lyme disease. I don't care what any blood test says. So we're starting to treat them. Okay? Flu-like syndrome after the tick bite too. We're treating for Lyme disease. I don't care what the lab test says. Let's see. The symptoms are the biggest thing that we go by. Okay? But you're stuck in the middle because everybody wants that positive test. People, you know, the population is used to having that positive test. So we still have to try to do the blood work or the labs to find it. Does anybody have any questions up to this point? What? Oh, go ahead. Sorry.
Just how do you deal with the fact that they don't have the money for the test?
That's tough. The way I approach that, my first thing, I send a quest out of my office. We draw the labs. Courier comes every day, picks it up. I will still run the labs through Quest. They're much better at finding Lyme. I rarely see Babesia or Bartonella come back positive out of Quest. I do find Rocky Mountain spotted fever and Q fever out of Quest. Okay, Ehrlichia and Anaplasma are kind of on the no side. So I will go down that path. If they can't do any further testing, I will start to treat and see if I can get them better. Tell them, okay, we'll go down this path. If I'm not getting you better, then we're going to have to back off, pull you off the antibiotics for 1 to 2 months, and then try to figure a way to get the testing done. So I try to prepare them for that we might have to go down that path, that they can start preparing for it. But I will start trying to treat them to see if I get a response. Okay, so everyone probably knows a lot of the symptoms of Lyme, right? Muscle ache, joint pain, okay? Fatigue, which certainly goes down with what Dr. Gattuso was talking. Okay, whenever someone comes in with a frontal headache, not relieved, I mean, it's a 24/7 headache. Maybe wax and wanes a little bit, but buddy, it's always there. I'm thinking Q fever. And especially if the person is a farmer with a lot of animal exposures, especially with birthing, I find a lot of Q fever. If they come in with night sweats, air hunger, a lot of GI symptoms, gastroparesis, where your food just doesn't move out of your stomach, I'm thinking Babesia. Bartonella can be more emotional, like anger, rage, irritability, also skin lesions. Like everybody's seen a pregnant woman that has stretch marks I have guys come in, lift up their shirt, and they have stretch marks, all around. Without them having a history of being obese or heavy to create them. Okay? Anybody know what a cherry hemangioma is? Do you ever see a little red spot that you get on your skin that looks like a collection of capillaries that come to the surface? That's also goes along with a Bartonella infection. Okay? So you use a lot of what the person is telling you, plus what you find on physical exam, to try to clue in as to where I should go with the treatment. Sure.
Can you biopsy that, the Bartonella cherry aneurysm?
I don't know that. I've never sent anyone to derm that's biopsied those for me.
Okay.
So I don't know if that would work or not. I know you can biopsy Lyme out of the erythema migrans rash. Okay, and I forget if I said it, but less than 50% of people get the bullseye rash. It's supposed to be 30 to 40% present with the bullseye rash. So that means well over half of people don't even get the rash. Yeah. Okay, so as far as treatment, well, my approach is if people are sick, I get them on antibiotics. Okay, a big herbalist in this area is Stephen Buhner. He even says when people are sick, put them on antibiotics. My goal, though, is to get you feeling better, get you off the antibiotics, get you over on herbal protocols, and really work at strengthening your immune system. I put it to people that your immune system is your good army, these bugs are your bad army. If you're really sick, your bad army is way bigger than your good army. So we need to beat it down, get it under control, and then at the same time, work and get your big army strong and beefed up. So that's going to be your best defense of keeping these under control in the long term. Okay? I don't want you on antibiotics. I want to get people off of them. But when someone can't participate in life, whenever someone can't do the things they need to do with their job, with their families, I think we have to use the bigger guns to beat them down. Okay? Okay. Also, we work at it. This fits perfectly with what Dr. Gattuso talked about with the mitochondria. I tell people that mitochondria are the energy sources for your cells. Just like every house has a furnace. Okay? You can have oil in the tank, but it takes that furnace to turn on and make the ATP for the energy for your cell. These tick-borne illnesses will mess up the mitochondria and cause them not to work right. So that's another one of the things that he talked about. What's the toxin? What's the problem? Where's a disconnect happening? Okay? Well, they don't let you absorb great out of your gut, so you're not picking up the nutrition that's in your gut. It's not letting the nutrition get into the cell, let alone not letting the mitochondria take that oil. Okay? And the way I put it is the B vitamins, the vitamin C, the CoQ10 are called cofactors. So it takes everything working together in harmony to make it work. Okay? So just like, again, if you have gasoline in your car, does that mean you're going to go down the road? No. If your carburetor is dirty and it's not getting oxygen in to create the combustion, you're not going to go anywhere. So these cofactors are the oxygen, that it takes the oxygen to make the thing happen. So that's where your B vitamins come in, your vitamin C. Okay? And we get into, phase 1 and phase 2 detoxification pathways, and a big portion of that is methylation. Has anybody heard that before? Sure. Okay, so methylation is one of the ways that detoxification happens. If I have someone that I have on antibiotics and they're not getting better, and so I change them and attack it a little differently, or my thought process says, okay, instead of going after the Lyme, let me go after the Bartonella first. If they're still not getting better, I tend to jump to another test. It's a blood test, and it looks at a lot of these at a lot of things with down the methylation pathway. So it'll look at a lot of your B vitamins, but it goes to a deeper level, and I find a lot of problems with something called folinic acid. Folinic, I think. Yeah, but a changed molecule of folate. Yeah. Find a lot of people, that's where the problem is. So if I can't get these people better, I'm going down and saying, what's wrong with your detoxification? So I'm doing a lot more liver detoxes. Okay, I never supplement with glutathione. Okay, the biggest, one of the biggest detoxifiers of your body. I never supplement with glutathione unless I first prove you need glutathione. Okay, I was taught that supplementing with glutathione is a double-edged sword. If the person needs it, you make a drastic improvement in that person. But if they don't need it, you can be very detrimental to the person by shutting down their own production of glutathione. So that's why I go the extra step, yes.
If you give somebody NAC, which is a precursor to that, is that going to do the same thing?
I think that's a little safer to do because your body's not going to make it into glutathione if it doesn't need it.
What about lipoic acid?
I use a lot of alpha lipoic acid. I use choline and inositol, which are two of the less common B vitamins, and alpha lipoic acid for anybody with really anything with their liver. If they've got hepatitis B, if they've got hepatitis C, any kind of fatty liver disease, I'm really supplementing. I have seen people that have had chronically elevated liver enzymes. I start those, check them, about 3 months later, I've got normal liver enzymes again. So I'm a big believer. I've proved that many times. Yeah, I proved that with myself whenever I had my gallstone not pancreatitis, I just have gallstone hepatitis. Yeah. So that's, yeah. So I drastically supplemented with those. Okay. I guess I'm just giving you a few pearls with that. I don't know if that's getting in too deep into the treatment because you should really have that. Don't do it without proper guidance. With that, I'm just giving you some few pearls to what I do whenever I have problems with people. Certainly, what Dr. Gattuso touched on, sleep studies are drastically important. I think that's a much bigger problem than we want to realize. I also look at thyroid studies, also hormone levels, of progesterone, estrogen, and testosterone. Try to balance those. I do a adrenal stress saliva kit where it looks at your cortisol levels typically between 7 and 9 in the morning, 11 and 1 in the afternoon, 4 and 6 in the afternoon, and then 10 to midnight. And I'll look at the cortisol levels along with melatonin. Try to balance that. Try to approach this from as holistic approach as you can, as much functional medicine as you can. And I've never done the true functional medicine course. I have done a tremendous amount of courses with a gentleman named Jeff Bland, who's a PhD in biochemistry, who I have totally respected since I was a resident. But I am not a true functional medicine person. But I think I do incorporate a lot of that into what I do in practice. Another thing, the vitamin D is extremely important. I know Dr. Gattuso talked about that also. Several years ago, Bland quoted this at a lecture I was at, that a study was done in Australia with lifeguards, so who gets more sun exposure, that didn't use sunscreen and that didn't supplement with vitamin D. And then they looked at 100 of these people, and they were all between 60 and 80. So I came home, man, I'm supplementing, I'm getting them to 60 to 80. Then about 2 or 3 years ago, 2 studies came out that said if you had a stroke, you had better outcomes following that stroke if your vitamin D level was above 85. The second study was less dementia if your vitamin D level was above 85. So man, I got everybody to 85. Also, IFM did a cancer week, about 10 years ago, 12 years ago, and it was on a primary care physician's approach to people with cancer, because they're living longer with the therapies today and everything. So there they wanted the vitamin D levels above 100, which that's, quote, toxic by most labs that we have. I can tell you that I accidentally took 3 people into the 150s and had no problems with calcium levels. I immediately checked calcium, and they were normal. People felt fine, I just decreased their dose. So, okay. Any questions?
What do you do when a patient comes in and got an obvious thing, and the patient's given 7 days of doxycycline and that's
Wow.
it?
Yeah.
And you're saying this is not going to work.
Right. I put him back on doxycycline. Yeah, we talked to him about
Like, how long would you give it then?
how long would I give it?
Yeah.
Burascano and Horowitz say to give it until they are symptom-free, then 6 weeks longer. Okay,
Supposing you're asymptomatic.
that's a good question.
You have a target
Yeah.
lesion. It was, basically the day it happened, because let's say the guy was out hunting, something
Yeah.
was obvious, then he had checked out, and he was starting on doxycycline that same day.
Yeah, I just read about that, because one of the things I see a lot of physicians doing is they give that, a 400 milligram dose once with a tick exposure. Yeah, it's a higher dose of doxy, but it's a one-time dose. And I just read that it was a really fouled study, what we were talking about earlier. It was a really fouled study because the person doing the study gave them that dose, but his assessment of if it worked or not was if they got the bullseye rash. But we already said only about 40% of people get a bullseye rash. So what happens to all that 60% that's not going to get the rash anyway? But yet that was his endpoint. So that was a horrible study, but people were doing it. If they are totally asymptomatic, how long ago was the tick bite? Was it last week or 2 weeks ago, or was it 3 years ago? So if it was relatively recently, I would put them back on the doxy, and then do the extended period of maybe 2 months of it. If it was a couple years ago, I don't know what I'd do then. I'd probably just wait and see if they wanted to do some testing for it. But then, do I expose somebody to antibiotic use whenever they're not sick? Yeah, I think then I would just go after boost your immune system. Maybe do some colloidal silvers. Maybe do artemisia, some wormwood, see if I could just treat them herbally for a while, and then watch for anything to come to progress. I mean, I struggle with this because one of my best friends is an avid hiker and kayaker. This man is in the woods every weekend. Okay? I could have him on doxycycline all the time. He's getting tick bites every weekend. So what do? I can't put him on antibiotics all the time. So we just work at strengthening immune system. Yeah, and he has to call me right away if he gets sick. Yeah. Here's something that I probably forgot to say. One of the ways that the Lyme disease fools your immune system is it exists in your body as a spirochete, right? As a corkscrew-shaped bacteria. Okay, and I remember being in your office and you showed me spirochetes out of dental plaque. Well, do they, is that significant or not? What is it? I don't know. But the second thing they can do is they can form a cyst. So that's a water balloon with the spirochete inside the cyst. Well, as long as it's in the cyst, I can't kill it. unless I break open the cyst and expose it. The third way is they'll layer on top of each other and they'll form what's called biofilms. And both of these things are proven by electron microscopy. So we can see that these are actual entities, okay? I say the biofilm, that's a hotel for Lyme disease. Okay, and as long as they're inside the hotel, I can't kill them. So you have to do things to try to break open, bust open the biofilms. Was it the American Academy of Infectious Disease or whatever they're called? They don't believe in chronic Lyme. The people in iLabs believe in chronic Lyme because if I treat and I leave any of these cysts or any of these biofilms there, they're going to reproduce again. At some point in time, they're going to come out and rear their head again and start causing problems. Okay? And that's the same for Babesia. Babesia is a malaria-like protozoa, right? So it lives inside your red blood cells. Okay? When I treat somebody for Babesia, I treat them for a minimum of 4 months because you turn over your red blood cells every 3 months. A red blood cell lives 90 days. So in your body right now, you have red blood cells 1 day old, the whole way through 89 days old. So I treat for someplace in the 3 to 4 months, figuring I've got a whole turnover of the red blood cells. So they've broken apart, the little critter's gone running from one to the other, and I've had Meperon or Malarone there. Try to kill off as many as I can. But again, you leave a couple of them float around, they're going to reproduce after a while. So that's where, again, we build the immune system, try to keep things in check. Then how do you feel? You know, what do you do? Okay, let's go off antibiotics for a while, see how well you do. Okay? You know, do the herbal preparations, do the colloidal silvers, boost the immune system. And I have an immune system recipe I'll bring along next time that I get people on. It has garlic, ginger, cayenne pepper, onions, agave nectar. There's another thing or two I'm missing. And blend it up with a bunch of water. What I do personally, since it's just me, I keep out like a week or two's worth, I freeze the rest in baggies. Then I get out one of my baggies, thaw it, there's enough for a week. Yeah. You know, and then sit there and drink your quarter cup or half a cup a day. And that's supposed to be a big immune system boost. Also big anti-inflammatory. You know, so inflammation being the root of all evil and disease. What's it going to hurt? I don't think it's going to hurt a thing. So do it. Sure.
Is there a name for that little cocktail you just...
You know what? I found it in a book called Balanced Living. Okay, bought the book and found it in there. Yeah. So I photocopy it, tell everybody where it came from, and hand it out. Yeah. Go ahead.
Do you know what the ticks are doing to nature? I understand wild turkeys love ticks. Is it affecting the turkeys and
I don't know what to...
they ingest them?
Yeah, they eat them and kill them. Possums also supposedly really like 500 ticks a night, supposedly.
It's not affecting them?
I have no idea. I'm not a hunter. I don't know. Yeah, I have no idea. Any kind of fowl, guineas, pheasants, yeah, possums, yeah, are supposed to be big tick eaters. Yeah. So that would be my solution, is get a bunch of them, and that's what I'm planning on doing, getting a bunch of them and putting them on the farm.
Yep.
So.
You can't have flowers at the same time.
That's okay. I'd rather have the birds. Yeah. So. Okay. Does anybody have any questions? Anything? Sure.
What do you do for the, when you're in the situation where you think there's a lot of biofilms there and you don't want to disrupt them?
Oh, and you don't want to disrupt
In
them?
other words, thinking that you're going to let all elders.
Yeah, and get a big Herxheimer reaction.
Right.
Yeah. I usually start, I have a goal of doxy and a goal of dosages that I'd like to get to. I'll start off very slow, with low doses and build them up. You usually have to treat with maybe 2 or 3 antibiotics concurrently. I'll start one at a time and slowly build up the dosages. For biofilms, I use xylitol and also the liquid stevia, or usually not in conjunction, just usually one. The streptokinase, and I'll just start slowly, and then if the person herxes, I'm not out to make somebody sick, I'll back off. Work at liver detox. If it's a big thing, I'll try to get the methylation labs so I know where to supplement to get them methylating better. I do Epsom salt soaks, antihistamines like Claritin, Allegra, Zyrtec. Alka-Seltzer Gold is another big one to help with detoxing and to get rid of to try to help cut down the Herxheimer reaction.
How's it do?
With antihistamines and stabilizing the mast cells histamine release from mast cells, sorry. Yeah, go ahead.
Do you do anything to support the gut microbiota when you're
Oh, absolutely. Tons of probiotics and prebiotics. Yeah, good question, yeah.
What about sauerkraut? I heard that 4 to 6 ounces of homemade sauerkraut, or one that's not pasteurized, is equal to 100 probiotic pills. Is that true?
I don't
A
know.
lot of people thinking they're only going to push it for the prebiotics,
Yeah.
instead of the pro. Because you get, where do you stop with
Yeah.
probiotics?
Right. Yeah. Although you're supposed to take probiotics forever with our horrible nutrition from store-bought foods, with that we don't have the gut flora that we should. Yes. And I tell people to also cycle, if you're buying probiotics and you're not doing kefir, you're not making your own, doing your own sauerkraut, cycle different brands of probiotics so you get a different culture base.
And the Lactobacillus plantarum, which is an Alexander organism, is a really good one to make sure you have.
Okay. Yes. Oops.
I have one final question, that is,
Sure.
what's the prognosis for the patients who've got mental status changes? I mean,
Wow.
really
Yeah.
significant, you look at them and they're 40 years old, but they're acting like they're 70.
Yeah.
And
That's where I struggle, and this is what I'm doing at this point. If I've got someone that I think needs IV antibiotics, because I think if they have the Borrelia, yeah, and I'm sending them out to get Noonan or Stone Cipher to help me with them, and I'm doing that to kind of cover my tail, because supposedly the powers that be look and see how many PICC lines and how many ports you're putting in people, and that's how they're judging about the antibiotic use. I heard that's how they're tracking. So I'm trying to get somebody else to write me a letter to say, this is what I'm recommending happen with this patient. Then if I ever get audited, or if they ever want my charts, then I can send that in saying I'm following orders. And that's just kind of a cover my tail medicine or approach to it. I've got a disaster case right now who's a lady that's been tick bite, was fine before the tick bite, had a known tick bite, known rash, known illness. Now, a short time later, she's horribly debilitated and been labeled with Parkinson's disease. And she's a tremor all over the place, and she's getting contractured, and cognitively she's still there. She's totally there. But to the point where needing somebody to feed her, needing her ADLs, assisted with. So she's been to see Noonan, and we've just started her on Rocephin. She's only getting 500 milligrams right now, 4 days a week, 3 days off, and we're going to hopefully get her up to 2 grams on the 4 days and then 3 days off. Yeah, and we're also she's also BART positive, Bartonella, so we're doing Bactrim for the BART. So Yeah. Had another lady. This was a disaster case. This lady passed, came to me labeled with ALS, but didn't get worse with her symptoms of ALS. But we found Lyme and Babesia with her. And she also worked in the printing industry for 20 years in the 70s and 60s, 70s, and 80s, where they had no safeguards. So she was in ink and chemicals and colored ink all the time. So where do you start there? You know, we chelated her. She was loaded with heavy metals, more heavy metals on a 9-hour urine than I've ever seen. You know, and then we started with the antibiotics too, because supposedly the tick-borne illnesses can hide behind heavy metals, and the heavy metals prevent the antibiotics from working. So we have to, you know, judge when we're trying to go down that pathway too. So, okay. I think I've yacked enough for tonight. So,
Thank you very much.
no, thank you. Yeah.